Veterans who suffer from post-traumatic stress disorder are finding new hope in an injection. The stellate ganglion block injection takes about 15 minutes to administer and has led to dramatic improvements. Dr. Eugene Lipov pioneered the procedure back in 2007 and has been a strong advocate. We're joined now by the doctor to learn more about the effectiveness of SGB, as it's called, for PTSD. So, doctor, tell us a little bit more about the injection.
So it's essentially, thank you for having me on, by the way. So essentially it's an anesthetic procedure that I've been doing for a long time, for about 30 years. About 15 years ago, I figured out that it will help PTSD. It's essentially a placement of local anesthetic in the neck on the right side. It has to be very precise. We use X-ray guidance to place the needle in the correct area.
Doctor, I'm curious, why in the neck?
Well, because if I may, I'd like to tell you what PTSD is and what it's not from my perspective. PTSD is a biological phenomenon. When somebody is faced by severe stress, military and non-military, nerve fibers grow inside the brain, which increase norepinephrine or fight and flight system. And that seems to be controlled by a specific ganglion, fight and flight ganglion in the neck. That's why it has to be in the neck, and what it does is deactivate the place in the neck or in the brain called the amygdala. Amygdala seems to control the fear center, and that has been shown many times by using functional MRI and objective scans.
Okay, so doctor, what type of results are you seeing? How do patients react to this injection?
Well, we've been very fortunate. So I have been doing it, as I said, for a while, and we have been trying to maximize the results. Currently, our success rate is 90 to 92% in the last 200 patients we treated. There were some modifications I've made since the beginning. But the great thing about it is when we do the procedure, patients in about 5-10 minutes feel amazingly better. In fact, I met with one man. His name is Clint. We treated him in 2015. He had one set of procedures. And he saw me in 2019, 4 years later, after one procedure. He's doing great. He lost weight. He reconciled with his wife. His kids love him again. And he's working as a senior guy on Amazon.
That's wonderful. That's obviously a great success story. What do you say, though, to your critics out there?
Which particular critique are we talking about?
Well, there are some who aren't quite sure that this does offer the sort of hope for PTSD, those who suffer from PTSD, as you claim they do.
Oh, I understand the question. Thank you. First of all, this has been now replicated in the military institutions. Approximately 2,500 military personnel has been treated with those procedures. The results have spoken for themselves. There is no nobody can be treated 100%, of course. I think the main problem has been credulity, meaning people cannot believe it could be that relatively simple. And I've had a number of people tell me, this block has been done since 1925. Who are you to come up with a new use of it in 2000? It just happened to be a unique circumstance that I was investigating hot flashes, and I came across a paper from Finland where they were clipping sympathetic ganglia in the chest to take away sweating in the hand, and it fixed PTSD. And then I reviewed the biology, and that's how I came to that.
Got it. Well, we appreciate you coming on and talking about this again. It is offering a lot of hope to those who suffer from PTSD. Thank you so much, doctor. Appreciate your time.